A speaker called Marc Dixon-Seager. He's also been in the field of addiction for more than 20 years. He's also a DBT specialist, dialectical behavior therapy. Over to Marc.
Good afternoon, folks. Just getting myself into a comfortable position. I hope you guys can hear me clearly. I think it's important to really kind of give you a little bit of definition around addiction from an addiction specialist perspective. And it's really can be described as a primary progressive illness that, if not treated, can be fatal. We as a person in recovery, informs you cannot get rid of an addictive core. It's there. One needs to be aware of it, and one needs to kind of manage it. It's not really kind of uncommon with a person coming off substances to cross-addict or to substitute into other addictions, primarily which we refer to as processed addiction. So really addiction is more so about what we take, but when we think about substitute addictions or processed addictions, it's not about what we take, but more so about what we do that creates that internal chemical high or dopamine release that Dr. Steve was making reference to. It follows the exact same criteria. So obviously, Steve made mention to the loss of control. In other words, when a person picks up that drug or picks up that drink, that at that point that they are out of choice. In other words, they have no control of the outcome thereafter. That again, the continued usage in spite of the adverse consequences. Often the addict, often the alcoholic know what the consequences are, but it doesn't stop the individual from kind of doing it. There's also that level of obsession of compulsion, just to give you a little bit of an understanding about it. The mental obsession really is the mental process, which triggers and escalates certain feelings. The common one is obviously anxiety. And then the individual will act out in a compulsive manner to try and bring down or regulate those levels of anxiety. And then, of course, the kind of craving for the substance. The minute an individual induces the alcohol or juices alcohol, obviously it sets off or triggers off the physiological craving for the substance. And again, what the psychiatrist and what Dr. Steve referred to is that increased tolerance. In other words, an individual needs more and more of the substance in order to achieve the desired effect. And then last I'd like just to add it is obviously increased time. So where more and more time is starting to be utilized in this particular activity. So for example, the preoccupation levels, the scoring of the substances or the purchasing of the substances, the usage of the substances, and then of course recovering from the effects of it. Perhaps I'd like to touch a little bit more on this processed addiction because I think addiction is so far outreaching these days that there are other addictions that are a little bit more kind of subtle. Let me just reiterate again, the processed addiction is more so about what we do that creates that internal reward or that internal chemical high. I think the common one these days is kind of social media. Should I say non-fiction books? Should I say series? Anything to do with kind of not being able to sit with certain feelings, not being able to cope with certain feelings, and not being able to be. So I think a big part of treatment is to be able to understand what are the feelings that kind of drive an individual to kind of act out on their substance of choice or drive an individual to kind of relapse. And I think the psychiatrist made strong reference to that this morning, that so often in order to understand addiction, we more so need to understand what the drug is doing for the individual, how it is serving the individual. So for example, a lot of people would use alcohol or drug as an antidepressant, which helps us deal with stress, helps us deal with anxiety, helps us deal with depression. And like we said, I think part of the assessment is to understand, is this individual using substance because they're depressed or because they're anxious? Or are they anxious or are they depressed because they're using substances? So that's a little bit kind of on the process addiction side of things. I think, it's treatment is obviously tailor-made to suit the individual and his specific needs. So there's no two kind of treatments alike. And there's a lot of different characteristics, idiosyncrasies, and factors that are taken into consideration in order to plot out a treatment plan. So really, the assessment that we undergo with the guys here at Eden Tranquility is extensive. And that assessment is really to understand a little bit more about the individual's strengths, their weaknesses, their mental states, and of course the presenting psychosocial problems. And of course, from that assessment, we then draw out a personal treatment plan. Often, I think, rehabilitation is also about system analysis, which means the systems at home need to be kind of looked at. Very often we have families that protect the individual from the, natural consequences of their behavior and their using. We need to kind of educate those families and be able to teach them how to offer the correct kind of help and the correct kind of support. I know for the addict, so often, addiction is very, very good at being able to condition family to react and respond in a certain way. And whilst the addict and alcoholic had the families believe that they're actually helping him, in actual fact, the addict has conditioned them to teach them how to enable their behavior and how to enable their addiction. It's often referred to as a family disease. I think at a very basic level, of course, it impacts the family at a certain level, but at a deeper level, obviously, we have these systemic roles that kind of parents and families tend to take on, of when they enable or they attempt to rescue or attempt to kind of fix, and don't allow the individual to kind of experience the full kind of consequences of the actions. It's not uncommon with the person coming in treatment that they don't really kind of identify with the magnitude, the depth and the severity of their problem, because the fundamental, characteristic of this problem is the psychopathology of what we call denial. And really what denial does is it doesn't allow the individual to see the severity, the depth and the magnitude of the actual problem and the destruction and the impact that it's having on the individual and of course on its family systems. So part of the treatment program is really to strip away the behavior and break down the pathology of denial in order to get to a person to a place of where they achieve a very, very deep level of acceptance and a very, very deep level of kind of surrender. So that was a very, very quick kind of overview in terms of kind of what treatment is about. As Steve said, it is a very kind of complex issue. There is a criteria that makes an individual eligible and appropriate to be obviously checked into inpatient treatment for a prolonged period. Okay, in closing, really just thank you guys for linking in us today.